So, okay. Um, okay. As everyone knows, COVID is still with us. All
Always.
right. It has not retreated and it continues to manifest various in its variants. And there's new variants, and it seems like every day there's new variants. Um, but anyway, tonight we're going to talk about a little bit about long COVID. So, the definition of long COVID, let me see if I can move this or minimize it. Okay. So, long COVID is defined as signs, symptoms that continue or develop after an acute COVID infection. And so, the definition was developed by the Department of Health and Human Services with the CDC and other people, other partners, and people call long COVID by many names, including post-COVID conditions, long haul COVID, but I think more colloquially, it'll be long COVID. So it is a constellation of symptoms and health problems that can last weeks, months, or even years now that we're into our fourth year with COVID, or fourth or fifth year. And it occurs most often in people who've had severe COVID illness, but anyone who has been infected with the virus that causes COVID can experience it. One of the things that has been noted in studies is that um, people who had the original virus, like when it first came out in March or was more prevalent in the United States, um, in 2020, those people seem to develop long COVID. People were infected with that form of the virus more than uh, people who were infected with later variants of the virus. And as it says here, also people who are not vaccinated against COVID and become infected with COVID have a higher risk of developing long COVID compared to people who have been vaccinated. So what you need to know is, and this is all that we found out through the years, is that people can be reinfected with COVID. So just because you got it once, or a couple of once, many, like when it first came out, doesn't mean that you cannot be reinfected. And that's because they're variants and our bodies don't have the immune response to the variants so that you can really not be affected. But we can be reinfected multiple times. And I'm sure some of you know that as firsthand knowledge, that you've gotten COVID a few times. So, and it says while most people with long COVID have evidence of infection, sometimes a person with long COVID may not have tested positive for the virus or even known that they were infected. And so that's a point that we don't understand, and we're working to understand more about who gets long COVID, why, and why these situations happen. People don't know that they were infected, but yet they've developed long COVID. Okay, all right, what's going on? So, so long COVID, okay, is a wide range of new, returning, or ongoing health problems that people experience after being infected with the virus. Most people with COVID-19 get better within a few days to a few weeks after infection. So at least 4 weeks after infection is the start of when long COVID could first be identified. So, in other words, you got acute COVID, you got over it in a few days or a few weeks, but after about a month of having had COVID, then you start getting symptoms. So anyone who was infected can experience long COVID, and most people with long COVID experience symptoms days after learning they had COVID, but they don't know. Some people just don't know when they got infected. And this is what's happening now anecdotally. A few people that I know just never suspected, maybe had a stuffy nose or something like that, and didn't know that they had COVID. And then they tested and they were surprised because they don't know how they got it, who they got it from, where they got it, etc. So, what is going on with this? Okay. So long COVID is not one illness. So it's not one thing like, like you get, um, I'm just throwing out an example, a muscle pain, and then that is associated, everybody who had long COVID gets a muscle pain. So it's not that. It's it's a constellation of symptoms. Okay. So, um, long COVID affects different people in different ways. All right. So not everybody has the same identical symptoms to say, okay, that's long COVID. So some people may get tiredness or fatigue that interferes with daily life. Some people have symptoms that get worse after physical or mental effort. Some people have fever and then just ongoing fever. Another symptom can be difficulty breathing or shortness of breath, cough, chest pain, um, palpitations. So your heart feeling like it's beating very fast in your chest. So some people have neurologic symptoms, difficulty thinking or concentrating, like they refer to that as a brain fog, headache, sleep problems, dizziness when you stand up, so that's lightheadedness, pins and needles feelings, change in smell or taste. Some people have depression or anxiety. Some people have diarrhea, stomach pain, joint or muscle pain, rashes, changes in menstrual cycles. So as you can see, the range of symptoms is protean. It's a lot of different symptoms, and these symptoms can be correlated with other illnesses as well, but somehow you have to put all of this together in association with COVID before you call it long COVID. All right. Um, So some people, especially those who have had severe COVID, can experience multi-organ effects or autoimmune conditions with symptoms lasting weeks, months, or even years. So you may have fever, but also have brain fog. So you can have multiple body systems affected at the same time. And that can be associated with long COVID. So multi-organ effects can involve many body systems, including the heart, lung, kidneys, skin, and brain. As a result of these effects, people who have had COVID-19 may be more likely to develop new health conditions, such as diabetes, heart conditions, blood clots, and that's something that we've frequently noted, blood clots or neurological conditions compared with people who have not had COVID-19. Um, some people may be more risk for developing long COVID, and we're trying to understand, researchers are trying to understand who um, is susceptible to long COVID and why, because it's not really clear other than the correlation in terms of being infected with that first that first variant of COVID. And that group of people is more likely to get long COVID than subsequent infections with subsequent variants of COVID. So, um, but in general, they're trying to understand why and which people are more likely to have long COVID and why. Okay. So, some of the issues that have been raised is this is, just noted, but not, it's just things that we've observed. People have had more severe COVID, and those who were hospitalized or needed intensive care may develop long COVID. And then people have had underlying health conditions prior to COVID, and definitely people who did not get a COVID-19 vaccine. So I think we are at the end of this part of the presentation. We're going to, speak more about it as we get more information on it. And but the takeaways from this really is get the vaccine. All right. So I think we spoke about this a little while ago, but now the vaccine is one dose. Okay. And the booster is one dose. So when we first started with the vaccinations, remember everybody, we had two, you had to get a series of two at first. And then when the first variants came out, then, you had to get another booster and then another booster and all like that. But now for people who have never been vaccinated, it's one shot, okay? And then what is being recommended is that you get an update as they update the boosters, which is roughly about, well, it was once a year, like last September, there was an update to the booster in alignment with the flu vaccine. So you could have gotten the booster for COVID and the flu vaccine, one shot for the booster and one shot for the flu vaccine, and then you were good. So possibly, probably at the for the fall, as we encounter new variants, they'll have another booster. So it's turning out like you get your boosters like how you get the flu vaccine once a year. All right, so that's what we're looking at now. All right, questions? Any questions? Rosie, you're muted. Yes.
I'm sorry. You know, I'm so glad you're talking about this because with you guys, I'm the smartest person in the world when it comes to this information. But just to let you know, when I sit in church, there's a few of us that have masks, and I've been asked multiple times, "Why are you wearing that mask?" And now I know how
Well,
to how to say it real quick. COVID is, I don't know, but no, really, I'm looked upon like a strange person. In church Sunday, there was three of us. I think that I saw three of us with the mask. I'm just curious, maybe leaving mask in the back. I don't know if that's going to work. I have no idea. But now
but
that the church is getting more full too, there's a lot of people. We're sitting next to each other. I sit on my jacket because I want to make sure I'm not taking two spaces. Anyhow,
yeah, but you know, people wear masks for different reasons. If you have underlying health conditions, if you've possibly been exposed to COVID, if you're recovering from COVID. or just your personal preference, because we know that it spreads. You don't, some people don't know. I was talking to someone a week before they got COVID. They have no clue how they got it or who they got it from. Just being, and they were trying to be careful and not be around people and all like this. But sometimes you're around someone who's asymptomatic. So they don't have symptoms of COVID, but yet they're infected with COVID and they're spreading it. So you can wear your mask. There's no problem in that. No one should look at you strangely for wearing a mask. We know what we've all been through over these last 3 or 4 years. So there should not be any um, shame. There's no shame in wearing a mask, you know? So, and then just make sure you get your updated booster, because that will help too with the different variants that are out there. So,
I guess I get frustrated because it just seems like with all that we know, I guess people think that COVID is gone with the wind.
yeah.
I mean, I have
It's not
underlying
there until because they're no longer collecting the data the way they were during the height of the pandemic. So now the only data that they're able to get is from the wastewater. And I think we talked about this in the past also, where that's where they can see the activity of the virus, because we excrete that virus when you urinate. And that goes into the sewage system. And they always test the sewage system for all sorts of parasites, of bacteria, of viruses. So that's not something that is new. They've been doing that for many, many, many years. So now, they have COVID that they're testing, and that's the only way really between the wastewater and between the hospitalizations. Because if you get hospitalized for COVID, then it has to be reported. But otherwise, the reporting is no longer there. The funding is no longer there to test for COVID and all of those things. So we're not getting the same level of data that we were previously. But we know that it's there because anybody anecdotally can tell you about people who recently, got COVID and what happened and all like that. But there's no shame in wearing a mask. If you're going someplace and you're not sure, it's going to be crowded. And as we know at the church, it's getting more people are coming every Sunday. It's getting fuller, and even to using the overflow parking lot, etc. So more people are there, and you're closer together. So there's no problem in wearing your mask. Absolutely no problem.
No, I don't have the problem. I'm just wondering, you don't mind me suggesting that maybe we tell the congregation, hey guys, guess what? It's not over. It's not over. You know, for their own sake. But I guess your hands are tied. You can't tell the administration to tell them, guys, we prefer you wear a mask. I guess that's you're not able to get that suggestion out there.
Yeah, yeah,
Your hands are tied.
especially when it's
Hands are
no
tied.
longer a public health, um, you know, emergency.
Right.
Yeah.
Thank you.
Yes. Michelle,
Oh dear.
unmute yourself.
Can you hear me?
Yes. Yes,
Good
now.
evening, everyone. Yes, because I travel a lot around the summertime, I find that it is very helpful to me because prior to COVID, I used to have a lot of infection. Even though I don't wash my hair before I travel, I wait for a couple of days before I travel because I know my body. But before COVID, I used to have a lot of infection. I will have to call my doctor in New York, and then he will prescribe the antibiotic for me in Florida.
Mm-hmm.
Or I would have to carry when I went to Haiti or Jamaica. In Jamaica, I had to carry the antibiotic with me. But since COVID, I've been wearing my mask, even though now it has subsided. I still wear my mask, and it has been very, very beneficial. And I thank God for that because I used to suffer a lot. And my
Mm-hmm.
family couldn't understand because what happened is that it started with a mucus infection on my tonsil. And then I will have to, once I take the antibiotic and Tylenol, I will cough it out. But since now I'm wearing my mask when I travel, I have no issue. So it
Okay.
does help in a way.
Yes.
But also ventilation. I find ventilation.
Yes. Yes.
I see we have the doors open, which is good at church because I usually sit at the back because it's
Mm-hmm.
comfortable. I always sit there because I like to praise when you are singing. I want to feel comfortable. And
Mm-hmm.
especially now I had the foot problem. So I stayed at the back, but they do open the doors and it helps a lot with circulation. So I'm not worried. We have faith, and as you have God gave you this gift to tell us about what we're supposed to do. So with that in itself as well, so we will be okay.
Yes.
That's how I
And,
see it.
yeah. And don't
Mm-hmm.
forget also about washing your hands.
Mm-hmm.
Okay. Using the hand sanitizer. All right. Because you go places, you touch, um, like you go grocery shopping, you touch the grocery carts and stuff like
Mm-hmm.
that. So don't forget about also using the hand sanitizer as well. Yeah.
Yeah. And can
Other,
I say something as
yeah.
well?
Mm-hmm.
When using the bathroom and the doorknobs, always bring a tissue when you're opening up the door or you close. After you wash your hands, use a tissue to
Turn off
to
the water. Yeah.
turn off the water so you don't touch it and you put it in the garbage as you go along.
Right.
Yeah.
Right.
Mm-hmm. Yeah.
Other questions? I saw Pauline, you said something in the chat. Let me see what you said. Oh, you still, yes, you wipe down the carts, yes, and you still wear your mask at church. No problem. Yeah, and Dr. Sherry says, don't apologize for wearing your mask. Yeah, don't apologize for
Mm-hmm.
wearing your mask. You know, don't apologize because we've seen the effects like Michelle was saying,
Mm-hmm.
reduction in her respiratory illnesses from wearing the mask because people
Mm-hmm.
around you are carrying not only COVID but RSV and all of these other influenza and all these other little viruses and stuff,
Mm-hmm.
and just wearing your mask can help reduce that. And people are forgetting. I was in the supermarket the other day and this man sneezed, into his hands. And we're supposed to sneeze right into our elbows and but people forget. So
Mm-hmm.
that's why you need that hand sanitizer around you. That helps.
Mm-hmm.
That definitely helps. Let's see. Are there any records of um, being kept of people getting COVID on cruise ships and airplanes? I don't know about airplanes, but on cruise ships, their problem recently has not been COVID, but it's been norovirus, which is another virus of people in large quantities of people in close contact, and it gives diarrheal illness. Okay,
Mm-hmm.
so that's that's the problem with cruise ships. And any ships traveling in the United States are required to report those cases. And sometimes they have cut cruises short and have shut down cruise ships so that they can clean properly for norovirus. But that's the main issue that I've seen with cruising lately is that.
Okay,
Mhm.
excellent. Any other questions? Okay, I'm gonna show a graphic, and then after I show that graphic, I'm gonna have Dr. Sunday just talk to us a little bit about the work that we're doing in Far Rockaway. So in case anyone needs any kind of support in the local community or in their church or in a place of worship, they can reach out to us and we can support. So let me just show this graphic quickly. Based on what Dr. Coney has been discussing, I think this is a good graphic for us to cover a cough and a sneeze. Just a little reminder, if you don't have a tissue handy, just cough into your elbow and that will be helpful. Of course, still wear your mask. If you're like gonna be in a public setting, like you're going to the train, it's crowded, the subway are like crazy. I've not taken the subway in a while, but if you're taking the subway, please wear your mask, especially if it's very during rush hour. Wash your hands, even as we have said. You can wash your hands if there's no water and soap. Just use hand sanitizer. So some of those habits that we developed during the pandemic, we don't want to forget them. We want to still continue to adopt those practices because as we can see, based on some of the testimony on this platform, it helps you generally, not just from COVID, from other kind of infection. So I'm going to call on Dr. Sunday. He's going to talk a little bit about, I'm going to share a flyer. He's going to talk a little bit about what we're doing in Paracoy. Dr. Sunday, are you ready?
Yes.
Okay.
Yeah. Good evening, everybody. I just wanted to talk about the new initiative that Department of Health came up with. The initiative is titled BRAVE, BRAVE, and it stands for Building Resiliency and Vaccine Equity among, especially those communities that were hardest hit by COVID-19. So some of those communities, Faro Kowe community is part of it, especially the zip code 11691 and 11692. So Department of Health is partnering with us because they know what we have been doing in the community. We've been the voice of COVID education among the community and even other community at large. So we're here to continue to provide education regarding what is going on with COVID and other vaccines and whatever is going on in the community. So we've been a trusted voice in the community and we want to continue to do that. And we're here to be of help and assistance to any other community that might need us to support them because it's very, very important that we bring this information to our people so that it helps. And from my own experience, even what flu used to do in our community before, COVID flu could not do it anymore because we're so aware of what we need to do to to protect ourselves. And I mean, it's really helped us a lot. So, like everybody's been saying, continue to do what you're doing to protect yourself and your family. And Relum is always here to support if you want us to come to educate your people, to talk more to a group of people. And we have this platform that we never left. We stayed. We continue to give information regarding health and our people because we want to make sure that we are able to take care of our body to be able to do what we are supposed to do in life. Thank you very much for coming to listen to us again, and we'll continue to serve you.
Thank you so much, Dr. Sunday. Thank you, Dr. Crony. So we also have different kinds of support system. So for example, like if you have infection, you're infected with COVID, where do you go? Where do you get tested? I know a lot of places have closed down since the pandemic is in quote over, but there's still need in the community. So if you're like on our mailing list, if you want, you can just reach out to our post that email on the text. I think most of you are like on my list that I send the blast text out, WhatsApp and on the email. So that way we can give you where you can get tested, what kind of treatment is out there, which one is free, which one is out of pocket, and different things like that. And even some community and social service resources in our community. So yeah, I think that's all we have now. Dr. Coney, I don't know, do you want to add anything regarding the new initiative that we're engaging and how people can benefit from that?
Yes, well, what we really want to emphasize now, as I've said before, is that you should get the most recent booster. All right. Remember that COVID doesn't respect the season. It's not really like the flu in terms of, the flu is more prevalent in the winter into the early spring. But as you recall from the past, COVID was all through the summer, like all through the year, times that you would think that there wouldn't be COVID. So now, as the summer is approaching and everyone is getting ready to travel and to move about, I would highly recommend that you get your updated booster if you haven't gotten it. Now, you can get it from one of those like CVS Minute clinics, but you really need to, now it's not, readily available like that. So you need to speak to your primary provider or go to a clinic and get your booster. Okay, and that's what I would really recommend for this upcoming travel season.
Yeah.
Airplanes, as Rosie was saying, airplanes, you're shoved in there like sardines in a can, and there's no way to escape being in that airplane tightly congested with people that you don't know. So, I would just strongly recommend that you get an update vaccine. Okay.
We may actually be doing like a vaccine because sometimes we have occasional vaccination in the community. So if we're having one in April, I'll let you guys know. We just have to work it out with our partner pharmacists, and then we'll see if they're able to support that. So we'll let you know about that. I'll send the information out. Do you
All
continue?
right, I'm sorry, Pauline has a question. Is the new virus as serious as COVID? It is COVID, but it's just a variant. Does it mimic COVID? It's COVID, but it's just variant because from the original. So that virus, the original COVID virus has mutated multiple times. I don't know what number variant we are on now,
We
but
lost count.
yeah, we lost count because it's mutated so many times, but it's still a serious virus. And especially if you have not been vaccinated, it's a serious virus. You don't have, the immunity to ward it off or to lessen the effects of this virus. So that's why I would strongly recommend to get the updated vaccine, the updated booster.
Thanks for answering that. Before you hop off, should we consider this COVID rather? Should we consider the COVID like the new flu? Like, because it doesn't seem to be going nowhere, and is it just gonna continue mutating year round?
It just it does not seem to be going anywhere, and it does seem to be continually mutating. So, but unlike the flu, because the flu the flu is really an avian virus. So when the birds migrate from North America, South America, they pick up whatever variant of the flu virus is there, and then they travel back north. So that's how the flu virus works. But this COVID virus seems to just linger in the community, and it just mutates within the community. That's why I said there doesn't seem to be a season for it, because if you recall in the past, we had spikes in the summer when you would not anticipate having spikes in any virus activity. But there COVID was, in the middle of the summer. So it seems to be a year-round virus that just is continually mutating. And so we do what we can to keep up with these mutations and try to get the vaccines that are the most relevant to the newest mutations that are out there.
So yeah, there's a question in the chat. Sister Rosie has a question. Doesn't all pharmacists have the new COVID vaccine? They should, but we don't
Yeah.
partner with all of them. We only have one specific one that we partner with. So all pharmacists should have it, in addition to, what's that, Minute Clinic? What's that?
Yeah, the CVS Minute clinics.
A minute. What's that word? Say that word again.
Minute.
Is
1
that how
minute.
it's spelled? Minute. Oh, because it's short time. I never heard that before. Minute Clinic. Oh.
Yeah, that's what they call them.
Oh, really?
Yeah.
I didn't know that.
At CVS. Yeah, at CVS. Yeah.
Okay.
Yeah.
Okay, cool.
I
Thank
have one more question before you go, sorry.
No,
So I
apologize.
have both the boosters already. This third one, I know that they advertising for people over 65, something to that effect. Do I need to get that one also?
Yes, you should. You should get the latest booster, the latest one. Whatever the latest one is, that's what you should get. So if you did not get one in September, October, that's the latest one that came out, was in September, October of 2023.
Mm-hmm.
That's the latest booster that they have. Probably in the late summer, the early fall, they'll come out with another one to cover whatever variants developed through the year.
So that means we're going to be taking booster all the time, correct?
At least once a year. At least once a year.
Are they still being administered free, or your insurance has to cover them?
No, insurance has to cover it. No. There are in the city, in New York City, there are some avenues. It's called the Bridge Access Program, that you can go through and get a free vaccination. I don't know where you are, if that's available.
Yeah, 'cause
Um,
Carolina.
I'm not sure. I have to check with my doctor because I am, of course, I'm in North Carolina. So I have to
Right.
check with my doctor to
Right.
find out how that is administered and whether my insurance will cover it. Yes or
Right.
no, if they do it in-house, or I have to go to CVS to
Right.
get it done.
I do believe the federal government said that all insurance should cover the boosters, but whether or not your insurance will do it for free is, I don't know. That depends on insurance by insurance. But I think the requirement is for all insurers to cover, so they can't deny you getting the booster.
Yeah.
Well, I'm Medicare eligible now anyway, so I'll check
Yeah.
that out.
Well, with Medicare, it's free. With
Okay.
Medicare,
Yeah,
it's free. Yeah.
I'll check. Okay. All
We'll
right.
share
Thank
more
you so much.
information with you guys, and then links that you can click on to get more information regarding what's been discussed. We know we have some first-time guests on the platform. We want to welcome you. Thank you so much for joining us. If you want to unmute and say hi, that would be good. Miss Ayimo De Folashade, you can say hi.
Okay, hello. Hi.
Hi.
How you doing?
Thank you for joining us.
Thank you.
Pastor Joseph, I think Ademola, thank you for joining us. Constance Oni.
Ademoye.
Ademoye, I didn't see the whole of the name. Oh, okay.
Ademoye.
Ademoye. Yes, now I see it. I can read it, but I just didn't see it. I'm sorry.
Thank you. No problem.
Thank you. Constant Oni, thank you. Miss Ogo, you're constant. Thank you so much. So we're here. What Sunday is what Monday is this? This fourth Monday. We're here
Yeah.
second and fourth Monday. So you get a text from me on WhatsApp to remind you to come to join us. So thank you again. If you have any more questions, let us know. If not, we close the platform. We normally hear from 6. No, what am I saying? 7 to 8.
7.
I'm tired. I need to
Yeah.
be quiet. 7 to 8. That's what we hear every second and fourth Mondays.
I'm sorry, Rosie, it's going to be on YouTube. So just look for our
Remind me,
channel.
Rosie. You know, sometimes I say I'll do it and I forget. Please remind me, hound me down. I'm gonna try to do it today, so I will not forget. And then I'll put the link with the group in the chat.
All
Okay.
right. Everybody have a great evening.
Thank you.
Have a great week.
Thank you
Good
so
night.
much. Have a good
Good to
evening.
see
Good
you
Hi,
all.
night.
Nicole. Nice to see you,
Hi,
Nicole.
Sister Sherry. Hi,
All
my
those, even
dear.
our North Carolina family, we're glad to see